Welcome to Target PEBC. My name is Mohit Kolaria and today we'll be talking about part 2 of anticholinergics. So as you all might have seen that last time we were left with 2 parts remaining for the anticholinergics. So let's start with those. Okay, anticholinergics. So just to give you a brief review, so we discussed there were 2 types, right? The muscarinic and the nicotinic ones. So in nicotinic, so we in the previous part we discussed about the muscarinic ones, and now we'll be discussing the anticholinergic of nicotinic receptor antagonist, right? Okay, so please understand this nicely. The nicotinic type can be again divided into the ganglionic blockers and neuromuscular junction blockers. Muscular. Okay, so let's understand what are this exactly. Okay, it is very important because I know most of the students face difficulty in understanding this. So let's start. Say this is your spinal cord. Okay, and from there you have the parasympathetic innervations, right? So the pre-ganglionic, the post-ganglionic, and you have some organs, say your heart here, right? So this is a parasympathetic innervation. You have sympathetic ones. So the preganglionic is shorter in case of sympathetic, right? And the postganglionic one is longer. And you have your organ here. Okay. And the third one is the skeletal one. So you have skeletal muscles here. So this is ganglion, right? So the drugs, what happens is in parasympathetic and sympathetic, both of the preganglions have acetylcholine as its neurotransmitter, right? So this is the acetylcholine here, and at the skeletal muscle junction you have SEH as well. Okay, but here in parasympathetic you have ACH, that is acetylcholine, and here you have norepinephrine. All right, so the ACH ones here in the preganglionic works through nicotinic channels. So in the preganglionic neurons, your acetylcholine neurotransmitter, it moves further via acting on this nicotinic ion channels, and on the skeletal muscles also you have nicotinic ion channels. So the drugs that block this and this are called ganglionic blockers. Okay, and the drugs that block here is called neuromuscular junction blocker. Okay, so understand this nicely. Now let's go to ganglionic blockers. So the most important drug here you might need to know is nicotine. So now you might be confused. Nicotine is an agonist for this nicotinic ion channels. So how does it block, right? Okay, so ganglionic blockers, usually we do not use them. Okay, ganglionic blockers, how do they work? They are basically competitive antagonists that block nicotinic receptors. Okay, and the example of those drugs would be hexamethonium, mecamylamine, trimethopam. So these three drugs, they are basically competitive antagonists at nicotinic receptors. Now what would happen? Let's see. So if you are blocking this nicotinic ion channels, you block the parasympathetic transmission or you block the sympathetic transmission. So the toxic effects are very severe, very severe toxic effect, because of which we do not use this. Very severe toxic effects, which is due to blocking of both sympathetic, parasympathetic and sympathetic system. Okay, so you don't use this class of drugs. The drug would be nicotine. Varenicline. And okay, so how does this drug work? These both are agonist, right? So this is agonist and this is actually a partial agonist. Okay, so let's go back to the channels. So what happens usually when the nicotine binds to this nicotine ion channels? Okay, so nicotine binds to the receptor, right? Nicotine ion channels, and once this nicotine ion channel is bound, it causes depolarization, and that further leads to neurotransmission. But to continue this process of neurotransmission, what you have to do basically is this depolarization again gets back to repolarization, and the repolarization cycles keeps on moving. But because nicotine binds to this nicotine ion channels, it leads to the persistent depolarization. So what happens is this channels always stays on, right? So if it's always on, it cannot repolarize, and thus its capacity to transmit decreases. Okay, so it cannot further the neurotransmission. Okay, so this way, in real sense, it is blocking the activity, right? Blocking the activity. You have to understand this. So nicotine, although being an agonist, it gives you kick, right? So you get kick because of this initial depolarization, but after that, that persistent depolarization is actually blocking the further moving of the signal. So in that way, you are leading to symptoms which you do not like in your body, right? So let's discuss toxicities that might occur, okay, with this. Now, because this ganglionic blockers, what they do is they inhibit the sympathetic control, right? Sympathetic control, it blocks. This leads to postural hypertension. Postural hypotension, okay? Because it's blocking the parasympathetic system, it causes xerostomia, that is dryness of mouth, blurred vision, so mostly like an atropine like side effects, right? Constipation and sexual dysfunction, okay? Now let's move to neuromuscular blocker. Neuromuscular blockers, okay? So basically how these ones work are, as I show you, say this is your somatic motor neurons and it innervates the skeletal muscles, right? So on skeletal muscles you have nicotinic ion channels. This releases the ACH and ACH binds to the skeletal muscles and that leads to muscle contraction. So basically neuromuscular blockers, they inhibit this ACH mediated effects on skeletal muscles, right? So blockers inhibits this action, right? So now to study this we have to understand that there are two types. One is the non-depolarizing type of blockers and the other one is depolarization blockers, okay? So understand the difference nicely. This acts like it inhibits or blocks the nicotinic ion channel, okay? These depolarizing blockers basically acts as agonist but keeps ion channel in depolarizing state. So it actually leads to, so it's an agonist that keeps the channel always open. So this leads to inhibit the activity by persistent opening, while this is acting via competitive blockage of nicotinic ion channels, okay? So the examples of the drugs that are competitive antagonists at the nicotinic ion channels in skeletal muscles, they are tubocurarine, rocuronium, atracurium, cis-atracurium, okay? All these are non-depolarizing, while the depolarizing, the example is just one you have to remember, succinyl choline. Okay, now let's discuss the non-depolarizing ones, okay? First, the non-depolarizing, so they are competitive blockers, right? They are competitive blockers at nicotinic ion channels. So basically they prevent the binding of ACH, that is acetylcholine, to the end plate, right? Okay, from the pharmacokinetics point of view, all the drugs are given parenterally, okay, parenterally, and they are highly polar. So if they are highly polar, they do not cross blood-brain barrier, right? Do not cross BBB. Just understand this. For rocuronium, this drug is eliminated in bile, okay, bile secretion. There. While pancuronium tubocurarine eliminated through kidney. So in bile, so it has short duration of action. This has intermediate. Okay, now the important one to remember is atracurium and cis-atracurium. So what happens here, this atracurium, it is spontaneously broken down, breaks into, okay, metabolized into metabolite that is called laudanosine, okay, laudanosine, and this laudanosine metabolite causes seizures in patient. So they have come with the cis isomer of atracurium, which produces less laudanosine, okay. So you have less seizures or decreased seizures, or right. So it is the most widely used clinically, okay, relaxants, because these are blocking the muscle contraction. These all drugs are also known as skeletal muscle relaxants, okay. Okay, what other things you have to remember is, okay, because these are competitive blockers, you might also need to know that the effects can be reversed by increasing the concentration of acetylcholine at neuromuscular junctions, okay. If you increase the concentration of ACH, these drugs can be replaced. So how can you increase? By inhibiting acetylcholine esterase. If you inhibit acetylcholine esterase, you basically increase the acetylcholine concentration at those points, right? So these drugs can be used as, so acetylcholine inhibitors can be used like neostigmine, physostigmine. They can be used to reverse the effect of neuromuscular blockers. Now let's discuss depolarization blocker, okay. Depolarizing. So these are not competitive antagonists, right? Rather these are agonists that lead to persistent depolarization, right? So because it's causing depolarization continuously, the channels become inactive, and there is a blockage, right? Blockade of contraction, right? So it cannot, the channel has to come into its native state to get the effect again, but because it's keeping it excited or in depolarized state, your channels become inactive. Succinylcholine is the main drug. Okay, it is metabolized by pseudocholinesterases, right? Or it's also known as butyryl cholinesterase. Okay, and its duration of action is only in minutes. How can you reverse? You cannot reverse this blockade, right? The depolarizing blockers cannot be reversed. So here, if you give acetylcholinesterase inhibitors, it might worsen the condition, right? Why? Because if you are inhibiting the acetylcholinesterases, it also increases, it keeps the level of succinylcholine high in the synaptic or the end plate region, right? So if your succinylcholine is higher, it will lead the worsening of the condition, right? So let's discuss the toxicities of this class. So first is respiratory paralysis. Okay, respiratory paralysis. You have to remember that this class of drugs causes respiratory paralysis. Autonomic side effects, we can say, because autonomic ganglia is stimulated by succinylcholine, okay, I think the non-depolarizing ones, that is the rocuronium, atracurium, pancuronium, sorry, let's remove this for now. Tubocurarine and mivacurium. So these are non-depolarizing type, right? Non-depolarizing agents, blockers. So what they do basically, they cause it histamine release. Okay, so histamine release is the main side effect for these agents. Then the important one for succinylcholine, if given with inhaled anesthetics, like example isoflurane, can cause malignant hyperthermia. Very important side effect. Also aminoglycosides potentiates the action of succinylcholine, okay, but moderately, so it's also contraindicated. Okay, I think that's all from the ganglionic and the neuromuscular junction blockers. Thank you for watching my video. Please press like or subscribe to my channel. Thank you.